Good luck.
Yeah. They're going to be making some cuts to Medicaid, which I think is probably the most interesting kind of part of this bill. The cuts to Medicaid is probably going to put somewhere like about 16 million people in jeopardy of losing their Medicaid benefits.
Yeah.
And they are creating these stipulations
Yes.
on who can actually continue to receive these
Qualify.
benefits.
Yep.
Right. And there's this notion that people are just twiddling their thumbs just to get medical benefit. That people aren't working, aren't being productive just to get medical benefits. If people aren't working, aren't being productive, it's probably not just so they can get free healthcare. I mean, that's probably not what it is. However, because of this, it is estimated that about 16 million people will be without health insurance, um, which I don't really know how that's going to affect hospitals because hospitals still have to service you. There's a law called
Yeah.
there's a law called EMTALA that if anybody comes into an emergency department, that the hospital has to treat them. Hospital has to triage them. Doesn't matter if they have insurance or not. Doesn't matter if they are a citizen or undocumented. The hospital still has to treat them. A person can't die in a hospital lobby, right? And the hospital can't refuse whether or not you have health insurance. So, but what happens is the more people that don't have health insurance, now the hospital has to fit that bill.
Yeah.
Which now is going to be higher premiums because somebody got paid for it, right? So now it's going to be higher premiums. It's going to be higher co-pays because the less people that has health insurance, the less that they pay into the overall market.